Spinal cord injury, or SCI, is a neurological disorder affecting many people each year. It was reported that in 1999, more than 50,000 spinal cord injuries due to physical trauma occur each year in the United States. In developed countries, 32,000 new cases occur each year, which means that a new case appears about every 16 minutes. Most common cause is motor collisions, with impaired driving being a factor in most cases. Alcohol plays a factor in 25% of total spinal cord injuries and up to 35% of non-fatal motor collisions, resulting in traumatic injuries. So what are spinal cord injuries? In order to understand what they are, we welcome you to our crash course.
The spinal cord provides support to the upper body. One of its important roles is in connection with the nervous system. The spinal cord innervates nerves and sends out signals to the rest of the body, as well as the brain. It is divided into 5 distinct regions, which are the cervical, thoracic, lumbar, sacral, and coccygeal regions. The cervical region supports the skull and innervates mostly around the neck, shoulder, upper limbs, but with some innervation to the chest area. The thoracic region innervates mostly the chest area and extends some function to the abdominal region. The lumbar region mostly regulates information to and from the abdominal region and also the lower limbs. The sacral region overlaps the lumbar region, but mostly innervates the lower limbs. Lastly, we have the coccygeal region, which only has one nerve. It serves as a sensory innervation of the skin around the coccygeal region.
The spinal cord does not only send information between the periphery and the brain, it also regulates some functions and behaviors without direct input from the brain. SCI is a disruption of nerve signals at a particular point in the spinal cord. Depending on the area of the injury, the result can be partial or complete loss of function to some areas of the body. SCI is divided into 2 categories, incomplete and complete. Complete SCI is the entire loss of communication from the brain to the injured site at the spinal cord. Incomplete SCI is a partial transmission of neural signals that reach the periphery. There is preservation of some motor and sensory function. One of the most common characteristics of SCI is paralysis, which can be further broken down into 2 groups. Paraplegia is the injury at the thoracic, lumbar, or sacral segments where the functioning of the trunk, pelvic organs, and legs may be lost. Quadriplegia is the injury at the cervical region, resulting in the loss of function from the neck area and downwards.
The most common form of treatment for SCI is physical therapy. Also, drugs like methylprednisolone are administered within 8 hours of the injury to reduce nerve damage and decrease inflammation at the site of injury. In addition, surgery could be done to alleviate pain and other symptoms, fixing the alignment and stabilizing the spine. However, there is ongoing research on treating SCI and restoring some or all loss of function. For instance, researchers are looking at the use of stem cells in regaining function and promoting regeneration.
Some of the things that could be done to prevent SCI is by taking all safety precautions before doing anything. When driving, keep all focus on the road. That means no texting, calling, or doing any other forms of distraction. And most importantly, don't drink and drive.